Our guest today on Vital Signs is Mr. Michael Hughes. Mr. Hughes is an ocularist who worked with the West Virginia Division of Vocational Rehabilitation out of Clarksburg, West Virginia. And we're going to be talking about prostheses, particularly eye prostheses, or the old glass eye. Mr. Hughes, it's a pleasure having you with us today.
Well, thanks. I'm glad to be here.
Tell us a little bit, Michael, about what an ocularist is and something about your training, and then we'll get into what you do.
Okay. Ocularists are people that make artificial eyes. We hand make them, and they're made out of plastic. Unlike people think they're glass, we make them out of plastic. A lot of people work as an apprentice. I went to Penn State. I'm originally from Pennsylvania, and I went to Penn State, and I got my training in Philadelphia. I work now right outside of Washington, D.C., and like a lot of ocularists, I travel a little bit to different offices. And one office is with Mr. Riley at the vocational rehab in Clarksburg.
We should mention that there's only about 300 ocularists in the entire country, and it's not unusual for them to have multiple sites that they work out of.
That's correct. I work in Northern Virginia, in Richmond, and at the University of Virginia as well. There's not many of us, and we kind of have to cover a little territory to take care of the needs.
Well, I can say up front that I, as the doctor that refers to you, and the patients who you take care of, certainly appreciate what you do. Now, you mentioned that they're usually, or they used to be made out of glass, and we call them the glass eyes. Show us one of those pieces that you have there, the glass eye, and then we'll talk about that more.
Okay. Yeah. They eyes used to be out of glass, and they were made in Germany. Hand blown. These pieces, these are two broken pieces.
Now, I can say that in the old days when people did wear those, sometimes they would actually explode.
That's right.
From the change in temperatures or things.
That's right. They're hollow, and like a glass, like an ice cube, when you pour water on it, they'll crackle. The temperature changes would sometimes break and crack these right in the person's eye socket.
Now, we also mentioned that you make them, but in the old days, tell us how they used to do this when I'd send a patient in that needed a, quote, glass eye or a false eye.
Well, years ago, because of just the techniques of eyes and the way they're made, they'd be stock eyes, and what you would do is go into either a jeweler or some opticians they'd have these already assembled, and they would just try them in until they got an approximate size and color. A lot of times it wasn't that great of a cosmetic match, but it was the best they had in those days. Today we custom make them for each individual patient, and we hand paint them.